Right. Hello, everyone. Thanks for joining us for Healing Starts Here. I am here with Lorraine Lease today, who is going to be presenting on grief and grieving for us.
Hi, I'm Lorraine. I'm palliative care chaplain, and I just want to talk to you a little bit about grief and grieving for nurses in the ICU. And I'm going to go ahead and share my screen, and we'll get started. Um, okay. So first and foremost, we'll just talk a little bit about what grief is. Grief is really a natural response to loss. It's a strong emotion. And if you've ever experienced it, you know that it is something that sometimes is overwhelming. And it can happen really with any kind of loss. And it's something that is emotional suffering whenever somebody takes something that you love or when something that you love is taken away. It's a universal experience, it's a personal experience, and it's something um, that is experienced in its own timeline, in its own way, and it's something that can last for months, and it can sometimes last even longer than that. Um, there are many different kinds of causes of grief. These are just a few that you may have experienced yourself, um, or you may know other people who've experienced any of these, and that some of them are things like the death of a loved one. That's the most common thing that we think of when we think of grief, but there are other things, lots of different kinds of losses, loss of a relationship, the loss of a job. Um, Miscarriage is something that is a cause for grief, a kind of grief that is not often recognized. Um, Retirement, death of a pet, again, another loss that is somewhat recognized, but not as commonly recognized as need be sometimes. Loss of safety after a trauma, or even selling the family home. Um, and if we were to sit down and talk about it, you could probably name um, a bunch of other things that are causes for grief in your own life. And Sarah, do you want to talk a little bit about what ambiguous loss is?
Yeah. So when Lorraine and I met to discuss this topic of grief and grieving, we kept talking about it together, and what kept coming up for me personally were these examples that didn't really fit into the traditional categories of, loss of a family member or loss of a loved one that we kind of associate with grief. Things that kept coming up for me were related to work or related to daily routines, or just things that were a lot harder to put words to. And so Lorraine very wisely identified that as ambiguous loss. So a loss that occurs without closure or clear understanding. And I think if anything has been unclear, I think COVID has been just a very great time of misunderstanding and lack of clarity. So I came up with a couple of examples of ambiguous loss related to nursing. And these are examples that I personally felt were things that I've grieved over the past year and still am dealing with. So, like the first one being the normalcy or structure of work. Uh, when I come into work now, I have to spend 15 minutes putting on PPE and then 15 to go into a patient's room. And then when I leave, I take 10 or 15 minutes just taking it off. And then that takes away time from, documenting or patient care or finding the supply that should be in the drawer and it's not in the drawer. So now I have to go hunt it down. And it can be frustrating. It's really a loss of normalcy. And with that, a sense of control. I, especially last March and April, there was this period where I really had to acknowledge, I don't know what I'm getting into when I go into work. I have no clue what my assignment's going to be like. I have no clue if I'm going to have help. I have no clue. So that was like a really unstable feeling for me, and something I definitely had to grieve. Something that I'm still dealing with now is this loss of a sense of accomplishment or satisfaction with my work. When I got into nursing, it was to help people. And I really, really felt fulfillment in that the first couple of years of work. I would go in and I'd see the patients get better, and I'd hear about them being discharged. And it was a really rewarding profession. And this past year, that has not been the storyline. It's been really discouraging to experience just loss upon loss, and with that, patient deaths. It's funny because that seems like it would go in the category of like, oh, this is a pretty traditional grief, a human being has passed away. But for the care provider, we're walking in and this is a total stranger, and somehow we get attached in that 12-hour period or 1-hour period or however long it is that we have with them, and then they pass away. And it is kind of this weird, ambiguous feeling of loss that it's like I only knew them for a short period of their whole life, and yet I'm still attached, and it feels like I don't really almost even have a right to feel attached to them because I've just met them. But that's definitely another source of ambiguous loss, I think. And then I also listed trust in institutions. I think there was a strike at Swedish prior to the pandemic that I think there was a lot of trust loss there. The CDC in this whole pandemic, I mean, it was like for a month or two, it was basically as though the recommendations were changing on a weekly basis. And then even with the George Floyd death, it was difficult to have to experience this kind of recognition of things that maybe were not easy to acknowledge, and really seeing a side of our government that has been hidden for a while. So just a lot of different institutional losses. And then I already mentioned the enthusiasm for patient care and feeling like you're making an impact. It's really, really hard to grieve that because it's kind of lacking in a traditional structure. How do you grieve something that's related to how you feel about your career? But I think that it's good to look into that and to try to grieve those things, because it's important when you're feeling loss. It's so important to really acknowledge that and to move through the process of grieving. So we, I know that for me that's all relatable because that's what I had listed. But I don't know if any of you all like feel familiar with that or relate to that at all. You're welcome to share. If not, no worries.
I would say something, Sarah. Thank you very much for really articulating that. I think it was a really comprehensive list, and there could be many, many other things that could be on it. Mm-hmm. And I think what really came through to me is that every one of these things that you have listed and Lorraine listed are things that we grieve. We grieve those kinds of changes in our structure and our normal way of living. And the difficulty right now is that it's an ongoing kind of process. It's almost as though there isn't really a place to, kind of even almost wrap yourself around it, because mm-hmm. it's just kind of this continuum, which I think makes it even more difficult. I think it's really even more difficult to really, I think the impact is to acknowledge that there's grief around it and there's loss around it. It's more for me the sense of how to work with it, because it's ongoing. There isn't kind of almost a place to just, I mean, grief is never really done, but there's a place where you can kind of have a little bit more of a wrap around it. And this doesn't seem to be that process. So thank you for articulating that in a really beautiful way.
Yeah, thanks for sharing. Yeah, that's a really good point. We're really not able to wrap ourselves around it, and it is ongoing, which makes it even more difficult.
Yeah, and I think that's one of the most difficult things about ambiguous loss in general, and particularly in this time when so many of us are feeling that, is that lack of closure just makes it so particularly difficult. Yeah. And so I think, it calls to mind, what are all of these feelings? What are all these feelings that come up? And I think things like guilt and fear and anger and sorrow, and these are just feelings that roll around inside of us. And there are other things like shock and numbness and disbelief, or disorganization, confusion, any of these kinds of things that could be related to anxiety or panic or fear. All of these feelings really just well up when it comes to feeling grief. Other things: guilt, regret, sadness, depression, relief, release. There are physical symptoms, spiritual symptoms. Sometimes we end up with questioning, and just remembering that grief is a journey. It's sometimes related to the head and the heart. It brings up questions of meaning, and all of these things are normal feelings. So I just want to normalize all of that and say that it adds up over time, and particularly over this last year that we've been living through. What you're experiencing is cumulative grief. Just to say that this is an emotional response to multiple episodes of grief. So not only is this ambiguous loss, not only are these many different feelings that of grief, but they're cumulative. They've been adding and adding and adding up over this last year, and you're probably experiencing all of these or many of these feelings and having what we're calling cumulative grief. Which brings me to this idea of the Kubler-Ross grief cycle. Elizabeth Kubler-Ross created this idea of the grief cycle in the late 1960s, and actually she created it as a way of describing how people were reacting to terminal illness. Less so about bereavement, but more how people were reacting to their terminal illness. And the cycle involves this idea of denial, anger, bargaining, depression, and acceptance, which I'll talk just a little bit more about here in a minute. But these are just common feelings that anyone may be experiencing when they're grieving any kind of loss. And this is a very traditional way of looking at the grief cycle, this sort of wave, this wavy line, where you may be experiencing any of these things. And sometimes people see this as a linear process. It's less so linear as it is as it is a process. And what are these different phases? Denial is really this idea that this can't be happening to me, or a refusal to believe that the loss is real. And this is a way of the brain protecting itself from difficult news. Anger: why is this happening to me? Who can I blame? This is actually a way of protecting ourselves as we move closer, but not so close that we feel overwhelmed. Bargaining: make this not happen, and in return I will, or really thinking about this as an attempt to strike a deal with ourselves or maybe a higher power in order to cope with pain. And then depression: that's the feeling of, I'm too sad to do anything. Sadness when we realize that our life really has changed forever in some way. This again is a natural response to loss. And then acceptance: this is a feeling of peace in some way with what has happened, but it's not necessarily a feeling that the grief is over. And acceptance doesn't necessarily mean that we feel good about what has happened. There may still be hurt. It's just not quite in the same way. And there's a shift to a focus on the present, um, less so about what has been happening in the past. And I think, in addition to that wave formation that comes with the 5 stages of grief, sometimes this is a little more accurate of what the 5 stages of grief feel like. You may wake up in the morning and feel like you've reached a little bit of a state of acceptance. And then by the time you've had breakfast, you're in a state of anger. And the next thing you know, the anger leads to a feeling of bargaining. And by noon, you're in denial, and then you're back to depression. And by the end of the day, you've reached acceptance again. And this is all very, very normal in the 5 stages of grief. They're not necessarily a linear process. You can go through these stages over time, and they can feel all mixed up. This is just a very normal way of feeling and experiencing the 5 stages of grief. What's important to know too about the 5 stages of grief is that it's your journey. It's not anyone else's. There isn't a single way of experiencing it. It's really your own, and it can help you. That image that I just showed can just help you understand what you might be going through as you go through those serious changes. So some things to think about is that it's important to seek support for your grief and loss. And there's a variety of ways you can do that. These are just some of them. Talk to friends and family. Maybe accept that people will feel awkward when you're going through grief and loss, and they may try to comfort you, and they may try to comfort you in ways that feel a little uncomfortable to you. Draw comfort from your spirituality or grounding practices if you have any of those, and it may be a time to turn to some grounding practices that are new. Try to express your feelings in some way that's comfortable. For some people, that's writing a journal, drawing, physical movement. You can join a support group, talk to a therapist or a grief counselor. Getting through grief is hard to do alone. And I think finding ways to seek support during grief and loss is really important. And so now I want to invite you to do an exercise with me called the goodbye letter. It's fairly simple, but it's actually an opportunity to let go of some kind of loss in your life. This is something you can call to mind some things that you feel like you need to let go of, something that may be causing you grief. It's a good time to grab a pen and paper if you have it. Just take a minute here.
Do you have paper?
Yeah.
Okay.
And I like to start these things out by just taking a deep centering breath and just kind of dropping down into a heart space or into your body a little bit. And calling to mind whether it's a person or it could be a pet, it could be a situation, it could be something that represents loss in your life. And who is it or what is it that you want to say goodbye to now? And now come back to our space and just on your paper, just address your letter to and name your loss. And then write for a moment, I'm saying goodbye because. And then when you've had a chance to do that, think about this one. Saying goodbye makes me feel. So add that to your letter. Saying goodbye makes me feel. And when you've had a chance to do that, start with I remember a time when. And then for our next step, you taught me. And for our next step, something I want you to know is and then I will always remember. And when you're done with that one, sign it. And I realize that some of you may still be working on this, but I want to just say that the point of doing this letter is to really help you to let go, and to say goodbye, to just release something that you may have been holding on to, and recognizing that this is part of the process of grieving. Um, and hopefully it is something that can help in that cycle um, of managing your grief. So the question now is, how are you feeling in your own grief?
We'll go ahead and pause the recording here, but thank you so much, Lorraine. That was wonderful.